Good afternoon, and thank you for joining us at our virtual news conference. As we reported earlier this week, we've seen an uptick in the COVID positivity rates at our AdventHealth CentraCare urgent care clinics. We wanted to give you an opportunity to have your questions answered before the holiday weekend. So today we have Dr. Vincent Hsu, AdventHealth's Executive Director of Infection Prevention and Hospital Epidemiologist, with us. He will make a few remarks and then take your questions. Media are invited to text their questions at 407-490-3075, and please state your name and outlet when you do send that text. Again, the number is 407-490-3075. Now, this phone number is only available during this live media briefing. If you're watching a replay, please do not text in your questions. This number is not monitored at times outside of this briefing. And now, I'll turn it over to Dr. Hsu.
Good afternoon. As of this morning, we have had around 120 patients being treated for COVID in our hospitals throughout Central Florida. This includes Orange, Osceola, Seminole, Lake, Polk, Volusia, and Flagler counties. And this compares to around 1,700 that we've had at the peak of Delta. So certainly we're in a much better shape overall. We're not seeing a surge in hospitalizations due to Omicron at this time. We've learned from previous surges, however, that the positivity rates at our CentraCare urgent centers can be a good indication that an increase in hospitalizations are coming. And so certainly we're not taking that for granted. As of yesterday, the single-day positivity rate at CentraCare was almost 27%. And that is significantly increased from just a few weeks ago when it was at 5.5%. So as a result, we're not taking any chances, even though we are not seeing a surge right now in our patient population from an inpatient standpoint. We are prepared. We're doing everything we can to make sure that we are prepared for a potential surge in hospitalizations. But probably the most important thing that we want to make sure that we focus on is what you can do to protect yourself. And while we do recognize that that vaccinations against COVID-19 are less effective against Omicron, they still do provide protection, especially with a booster vaccine. We know that the population in Central Florida and as well as in much of the United States, that boosters have not been given to the same degree that the first and second doses are. So we want to really emphasize the importance of making sure that if you haven't received that booster and it's been a few months since your first and second dose, that you go ahead and get that. We've learned that antibodies will wane over time, and so having that boost is absolutely critical to boosting your immunity. We only found about 4% of positive cases at CentraCare were among people who already had the booster shot. So the vast majority of patients have not received that booster. We want to make sure that they do get that. So the most important message is really get your booster shot. It will help protect against Omicron. And certainly I do want to make sure that as the holidays continue, that we do other things that we know are going to help protect you against infection, because we recognize that vaccines are not 100%. Again, making sure that when you're in public that you keep your distance from other people whenever possible. Wearing a good fitted mask or double masking can certainly also reduce your chances and help with ensuring that you'll have a very safe and happy holidays. And with that, I will answer your questions.
All right, thank you very much, Dr. Hsu. The number to text your questions is 407-490-3075. Again, 407-490-3075. Our first question comes from Kristen from News 6, and she asks, how effective are monoclonal antibodies when it comes to combating the Omicron variant?
So we have seen that the Omicron variant, with its myriad of mutations that have occurred, are less effective to some of the monoclonal antibodies that have been given. This includes the Lilly product, which is the bamlanivimab, etesevimab, as well as the Regeneron product, REGEN-COV. And so we recognize that there are limitations to that. There is one monoclonal antibody that appears to continue to have effectiveness. That monoclonal antibody's name is called sotrovimab. It's made by GSK. And certainly, we want to make sure that we provide the best monoclonal antibodies possible. But one of the issues that we are limited in right now is that there may be shortages of monoclonal antibodies, and we are continuing to work with the state to make sure that we get the ones that we can that are effective to provide treatment for our patients.
You touched on this briefly, but that's the second question, is why do you think there is a shortage of monoclonal antibodies, specifically Regeneron?
Well, we're seeing a lot of demand now. We know that the percent positivity rate has shot up. We know that the community spread in the Central Florida area has gone up. And so as a result, the public is also more aware about the benefits of monoclonal antibodies. So there's a lot of demand for that, and this is an issue where demand outstrips supply. Again, continuing to work with our public health partners to make sure that AdventHealth continues to have the monoclonal antibodies to treat these infected patients is really what we want to try to do.
Next question, can the rapid tests or the at-home test detect Omicron? How reliable are they, or should people be getting a PCR test instead?
The rapid tests are reliable. The FDA has a list of sorry, I'll start again.
That's okay.
No, the rapid tests are reliable. The FDA does have a list of the rapid tests that work, and they include the vast majority of what's available on the market. So I'm very confident that rapid tests are there. Rapid tests are most reliable when you're testing early in the course. So if you start developing symptoms, get tested with a rapid test, it really is very good at detecting it. PCR, of course, is as well. So I am not worried about diagnosing it. If you have a negative test, then it's probably something else. And there are other viruses circulating around, such as influenza.
Next question comes from Carolina Cardona from WKMG, and she asks, should people have the same concerns with Omicron like they had with the Delta variant?
Well, we know Omicron is more transmissible. And we also know that people who have had full vaccinations, have been fully vaccinated, are at greater risk of developing what we call a breakthrough infection. So in this case, it is important to be as careful as possible, especially now that we are in the holidays. So as mentioned, if you've gotten your full dose and you're fully vaccinated, get that booster. That is one very important step you can do to help protect yourself. And at this point, I would continue to wear my mask whenever I go in public places. Keep your distance. I remember the days before the vaccines were available. That's what we did, and it worked. And I think that is another very important step that you can do, again, to make especially the holidays as safe as possible.
Next question comes from Brianna Ardonando from WTVT in Tampa. And she asks, since Omicron seems to lead to milder infections, does this mean you expect less COVID patients in the hospitals? And how is Omicron changing the number of vaccinated versus unvaccinated people in the hospital?
So our census as of this morning hovers around 120. And this has been pretty stable for the last couple of weeks or so. We have not seen an increase in our inpatient census, even though we recognize that our central care positivity rate is over 25%, and we've seen increased community transmission. So this does suggest that Omicron is less prone to cause severe disease, because we are not seeing those numbers in the hospital. But again, it's still early. We don't want to say this is done and over with. We are doing everything we can to prepare for a surge, to make sure that in case there is a surge, that we're ready for that.
All right, our next question comes from Nikki Ross from the Daytona Beach News Journal, and she asks, are you worried we will see capacity issues like New York did last year based on our current rise of increased infections?
We had our surge, our very serious surge in August of this year, and that really inundated us. I don't expect that we're going to see a surge quite like that. The reason that many of the hospitals in the north have been affected is largely because of Delta and because they did not have that significant surge, and there's probably also a seasonal variation as well. I don't think Omicron is necessarily adding to their specific burden at this time, because that surge started well before Omicron. But nonetheless, we can't take anything for granted, and we want to continue to prepare. If Omicron is going to cause a surge here in Central Florida, we will be ready for that.
All right, next question comes from Chris O'Donnell from the Tampa Bay Times, and he asks, we are seeing a surge in the number of people being tested in Florida. Is that holiday travel related, or does it suggest more infections?
It could be both factors involved, both folks getting around and mingling because of travel, as well as more infectivity. We do know that Omicron is more infectious, so clearly that has to be factored in. When you factor that in with travel because of the holidays, that is a recipe for more spread. And again, we talked a little bit about what you can do to protect yourself. And again, it's very important that if you haven't been vaccinated, please get vaccinated. If you've been vaccinated, get your third dose, get your booster, and continue to wear those masks around with you, around other people, and keep your distance to minimize the chance of spread.
Next question comes from Rochelle Alian from ABC Action News, and she asks, people have been asking questions about which kind of test they should use. Is there a preference for home testing versus a PCR versus a rapid test, or should people be going to their local pharmacy?
Well, my advice is to take any test that you have available. There are extreme shortages throughout the United States right now. There are shortages in the pharmacy. Anything that is FDA authorized, whether it be a self-test, whether you're able to get tested in the health department venue or at some other place, go get it done. What we certainly would want you to do is to get tested if you have symptoms, because we do know that Omicron is very contagious, and we want to make sure that you understand your status.
Next question says, there have been some concerns about getting Delta variant and Omicron variant at the same time. Is that possible? And are we seeing patients who may have both variants?
Right now, we're seeing a gradual, in fact, right now we're seeing pretty much a substantial number of Omicron cases that are supplanting Delta. You're really pretty much infected with one or the other as far as the one that really takes control and causes infection in your body. So, we're continuing to monitor the situation, but the CDC states that the majority of the variants right now in the United States is Omicron. I think we have to assume that if someone gets a new infection, it's likely going to be Omicron.
Next question comes from Caroline Catherman from the Orlando Sentinel, and she says, well, you say you've not seeing a surge at the hospitals now. At what point do we label an increase in hospitalizations as a surge?
Well, we watch that very carefully. We keep numbers very closely. Certainly, when you start seeing a gradual increase in the patient population due to COVID, we will start looking at that, and at some point we will call that a surge. But we are not there yet. So we're carefully monitoring our COVID census. It has remained stable for the last couple of weeks from an inpatient standpoint. But again, also recognize that there is a significant COVID issue outside the hospitals. And so what we want to try to do is to keep those numbers in the community as low as possible as well. So we know that the percent positivity rate is going up. We do know that there is increased spread. We do know that it's more infectious. So whether or not it's causing more hospitalization, certainly we're glad that it's not so far, but we want to make sure that the community is doing everything they can to prevent this spread from getting worse within the community.
We have another question from Chris O'Donnell from the Tampa Bay Times, and he asks, with Omicron's higher transmissibility, do you expect the number of infections to exceed the Delta surge in Florida? And if so, when would you expect that?
Yeah, so that's a good question. As far as the absolute number of infections, it depends on a lot of different factors. The vaccination status of a given population, how many of them have had the booster. We know that Delta really caused a significant surge in the summer, and presumably some of those remain infectious, some of them remain immune even to Omicron. So it's really hard to say whether or not Omicron is going to infect a greater number of folks than Delta. All we can say is what we want to try to do is to do what we can in the community to mitigate that risk, to try to prevent that from spreading to other people, because we do know it is more contagious.
We have another question from Rochelle Alian from ABC Action News, and she asks, are you noticing trends in Omicron patients that you're currently testing? Any trends in age or mitigating factors or anything like that?
So right now it's too early to say what kind of trends we've seen with Omicron, partly because even though we assume that many of our patients do have Omicron, we don't do the sequencing specifically for that. The sequencing is done only on a sample of patients, and so we will have some more information in the future, but right now it's just a little bit too early to tell. Most of the information that we have about transmission and so forth with Omicron occur in jurisdictions outside the United States, for example, South Africa or the UK, where they developed that surge earlier.
Next question comes from Angela Jacobs from WFTV. She asks, is it possible that Omicron stays in the community and we don't see a subsequent in-hospital surge, or is that unlikely?
Well, I think it's entirely possible that we may not see a significant surge. It really depends upon what that surge is. We have to also recognize that it's not just COVID that may cause an inpatient swelling. Other respiratory viruses, such as RSV, such as influenza, enterovirus, or rhinovirus could also cause a surge. I am of the opinion, as more time goes by, based on our observations, that we will probably not see a surge as significant as we had seen this summer. But again, it's too early to tell, and just because we have a significant number of people in the community that are infected, undoubtedly that will bring some of those patients into the hospital.
Final question, Dr. Hsu. We're coming up on the Christmas weekend, lots of holidays and family gatherings. What is your advice to people as they get together with family or travel over this long weekend?
I know this is not the holiday season that we wished could have occurred. I wish it were under different circumstances. But I certainly think that it is appropriate for many people to get together and get together during the holidays. What I would say is that please take the steps that you can to ensure that you will have a safe holiday season. There's nothing worse than transmitting a virus to a loved one that could have been prevented. And so in those cases, what we are saying is please protect yourself by getting vaccinated. If you've been fully vaccinated, make sure that you have gotten your booster dose as well. If you are concerned at all about transmission, especially if you're going in public areas or taking public transportation, wear a well-fitted mask. A medical grade mask. Double masking is also a very good strategy, keeping your distance, and enjoy the holidays. But if you take those steps, that will certainly increase the chances you'll have a very safe and happy holiday.
Dr. Hsu, thanks very much for taking so many questions and being with us for today. Quick note for the media, our AdventHealth communications offices will be closed over the Christmas weekend. We will return Monday should you have any questions. Once again, thanks everyone for tuning in, and we hope you have a very happy holiday weekend.